Good afternoon, everyone. Thank you for joining us for today's webinar, Wound Care, where positive patient outcomes and profitability combine. We're honored to have Holly Burkman sharing her expertise with us today. Holly is a respected practice management consultant, speaker, and author. She is also a regular contributor to our Amerix blog, where she offers practice management tips that can help you grow your practice. Without further ado, I will turn this webinar over to Holly Burkman. Welcome, Holly.
Good afternoon. So today we're going to talk about one of my most, exciting topics for me. I love to talk about wound care, but also adding increased profitability to your practice. So really what we will be discussing today is how we can bring cash flow into your office and also take good care of your patients through the distribution of wound care supplies. My name is Holly Burkman. My financial disclosures are I own Burkman Consulting. I also own Burkman DME LLC. My husband and I own Burkman Podiatry, and I'm also a consultant for Amerix Healthcare. Our legal jargon, as of this date, the information is correct and is the correct knowledge to the best of my ability. I always recommend that it's your obligation to check the information that is provided against your state laws and national laws. By continuing to watch this presentation, you agree to hold harmless Amerix Healthcare, me, Holly Burkman, and Burkman Consulting. So many of you guys are just barely starting to open up your practices full time, and some of you probably still are not. And during COVID, we've had a huge cash flow crunch for most of our offices. We have not been able to see the patients that we have seen in the past in the spring. We have not been able to do the procedures and elective surgeries during this time. And so for most of us, due to the lack of patient volume and our procedures, our cash flow has been a little bit in a crunch and has caused some financial difficulties. So as we're starting to reopen up our practices and see our patients again, it is vital that we start to get that cash flow coming in, and not just the normal cash flow that we've always had coming in prior to COVID, but that we start to implement new things into our practices that are going to increase our cash flow, because we really have to be able to make up the lost revenue that isn't there due to COVID. So for many of you, you see wound care patients. And when I talk to doctors about wound care patients, sometimes they think about these big, gnarly wounds that are present in their patients. And they tell me, they're like, I don't see that many wounds. Well, I would like you guys to think about your practices and think about, the Mrs. Smiths and Mr. Jones that come in and they have the smaller wounds that are just forming, that when you roll up their pant legs during their at-risk nail care, or if they come in for something else and you're noticing the small wounds on their legs, a lot of times podiatrists will choose to, treat those with Neosporin and a Band-Aid, or if they're starting to get a little bit bigger, some of them will send them out to wound care because they just kind of don't want to deal with the wounds. And I kind of ask you during this presentation for you to kind of open up your mind and to think about all the wound care patients that you see, whether the wounds are small or the wounds are a little bit bigger, and try and figure out how you can incorporate those wound care patients into your practice. Because right now we don't want to be sending them to the hospital or to the big wound care centers. It is much safer for you to be able to treat them in your office and give that comprehensive care to those patients. So along those lines, how can dispensing wound care products in your office help your patients? And the reason why they can help your patients is pretty simple. In our clinic, we dispense wound care supplies, and we have for several years, and the benefits are huge. So when when our physician would usually write a script for wound care products and get sent to the pharmacy, it's very difficult for us to dictate what type of wound care products they are receiving. And so if we were to write a prescription for collagen matrix, 9 times out of 10, that prescription would be filled with a very cheap substitute of a collagen matrix that most of the time, is made of a large majority of calcium alginate and not, the collagen that we are really wanting. But it's the cheapest thing that they can find, and so therefore they will be dispensing it to the patient. And that causes the patients to not have as good as wound care products as you could dispense in the office. It's very difficult for you to control what the pharmacy is giving your patients. Or when you do, those scripts to some of the bigger wound care companies, it's very difficult for you to, as a physician, for you to dictate what exact products that your patients are receiving. If you are dispensing these products in your office, you obviously have complete control over what type of products you are giving to your patients. Also, right now, patients want full service. When they come into your clinic, they don't want to have to go anywhere else. They don't want to go run to their pharmacy and try and figure out what it is that you wrote a script for, or to try and pick it up from their pharmacist, and then their pharmacist says that they need to come back in a couple of days because they don't have it in stock. Especially our elderly patients that we treat, for the most part, they're scared to get out of the house, and they don't want to be, they don't want to leave, and they're having a hard time even coming to our practices. And so it's very difficult for them to then actually go to the pharmacy and pick things up. So it is really in the best interest of your patients that you are dispensing wound care products in the office, so that you have complete control as to what the patients are receiving, and also that your patients are not having to go somewhere outside your office. So why do we dispense wound care products and supplies in our office? So as you can see on this chart, we have a non-dispensing physician and a dispensing physician. When we write that prescription, there are lots of statistics out there that patients don't actually fill all the prescriptions that we write. And so if you are also dispensing in your office, you're giving that product to the patient, so you know that they have it. They're not just thinking, oh, well, I'll get that filled later. I don't want to go to the pharmacy. I'll get that product later. And then when they come back in a week to see you, you find out that they still have not gotten the products for their wounds. Well, them not having products for a week or two can be very detrimental to their wound, to good wound care. Okay. And then also, as I talked about previously, we want to make sure that the patients are receiving high quality wound care supplies. Wound care supplies are across the board in their quality and their ability to heal. I will talk to doctors a lot about collagen because we use it almost exclusively in our office, and we have had amazing results at healing wounds. And I will talk to other physicians, and they're like, yeah, we tried collagen and it just didn't work. And then I always ask them, well, what kind of collagen did you use? And they'll tell me, or they don't remember. And I'm like, well, was it flaky or was it granular? And a lot of them are granular. And I will tell them that that's probably was not the best collagen for them to use. And if they were to use a high quality collagen, they would actually have better results. And as other doctors have started to use the higher quality collagens, they have found dramatic results with their patients. So it's really important that you're dispensing high quality wound care supplies to your patients. Okay, also, is the patient compliant? Studies have shown that there's a 60 to 70% increase in compliancy rate when a patient leaves with the doctor's leaves the doctor's office with product in hand. Again, this goes back to, they don't have to go to the pharmacy. They don't have to try and figure out what product they're getting. They're not getting it and not knowing what to do it, because when you're dispensing it in the office, you're able to actually show the patients how to use the product. Now, also the biggest thing besides your patient compliance and knowing that patients have good wound care supplies is the revenue is dramatically different. So these numbers are based off of national payment amounts and DMERC reimbursements. So some of you will have different reimbursement rates based off of where you are practicing. Oregon's going to pay a little bit different than New York City. Idaho's going to pay a little bit different than Texas. But for the most part, if you do an office visit and a debridement, you're looking at about a Medicare allowable of $194.70. Okay. Now, if you dispense wound care supplies along with your office procedures of an office visit and a debridement, you're looking at a total revenue of $1,308.96. So there's a substantial difference in your cash revenue and generation of revenue when you choose to dispense wound care supplies out of your office. So it's kind of a win-win situation for both the patient and for the provider. So really, as physicians, you need to stop giving away legitimate sources of income. We have been doing this in our office for years, and it is very much a legitimate source of income. This is not a product that, is experimental or not FDA approved or has not been proven sustainable. These are products that Medicare and insurance companies want you to give to your patients. They want them to heal and get better, because if they heal and get better, their cost, the insurance's cost to the patient, is a lot less. If their wounds do not get better, then the insurance company is looking at amputations and looking at trying to keep this patient alive and doing well. Studies have shown that, when a patient has a wound that then turns into an amputation, that the chances of them having more problems and then eventually dying within 5 years go up dramatically. So the insurance companies want you to give high quality wound care supplies to your patients and want you to see these patients and to heal them. It is in their financial best interest for you to do so. So if you go back and you think about how many wound care patients you see, and you can think about how much revenue that you are possibly missing by not dispensing wound care supplies. So in this slide, we're talking about a doctor seeing one wound care patient a week. Almost every podiatrist out there has at least one wound care patient that they see walk through their door. And they might not even be scheduled for wound care. This may be your at-risk nail care patients that come in, or your patients that come in with heel pain or anything like that. Just by rolling up their pant leg and looking and doing a full examination of their feet and their legs, you are going to see more than one wound care patient a week. Okay, so if you choose to dispense a 30-day Helix wound care kit to this patient, your reimbursement is going to be the $1,100 and change, and then also you have the price of the kit, and this is the price of the kit if you just purchase one kit. It has no volume discount with that. So your profit per wound is going to be $669. Okay, if you're just doing one wound care patient a week, your annual profit revenue is going to be an additional $35,000 a year. That is substantial for practices to add an additional $35,000 of net revenue. This is not gross, this is net revenue. Okay, and for the majority of you, you are seeing a lot more than one wound care patient a week. For those practices that are seeing 3 and 4 and 5 and 6 and 10 and 12 of these wound care patients a week, you can go ahead and times out that annual profit by 3 or 4 or 10 or 12, and it's going to be a substantial increase to your bottom line. And again, this is net profit, not gross profit. And so this is actually what is going to be at your bottom line. It's a substantial amount of extra revenue just by handing just by handing your patients wound care supplies that are going to help them heal. So what is collagen? For many of you, I keep talking about collagen and that we need to dispense this. For some of you, you may not know kind of what collagen is and how it helps heal the wound. So collagen helps create a moist wound environment for the wounds to heal, but it's actually also absorbing about 40 to 65% of its weight in fluids. It is also a great building block for these wounds to heal because it's replacing vital nutrients back into the body and the building blocks that's needed for tissue regeneration. Now, Medicare allows for up to 30 grams or matrixectomy pads. Each one of these grams come individually packaged, but Medicare allows up to 30 grams or matrix pads per month per wound. So like, let's say a patient comes in and they have 3 wounds, we're going to want to dispense up to 30 grams per wound. So if they have 3 wounds, you can dispense up to 90 grams of collagen, or in other words, it's going to be these 90 individual sterile packages of collagen per wound. So again, then that revenue goes up where you're getting, the 600 plus of net revenue. If the patient has 3 wounds and they're going to be treating those wounds for a month, you're looking at $1,800 plus just by handing these patients wound care products. So most of the time when physicians are getting started on this program, I recommend that they use a wound care kit provided by Amerix. And the reason for that is it's by far the simplest. You hand them these really nice boxes, and everything that they need to do their wound care is in the box. So they're not running to CVS or to Walgreens or to their local pharmacy to try and find wound wash or to try and find the correct bandages. You can do a wonderful, collagen wound care product, and then the patient goes to their local CVS and finds the cheapest Band-Aids that they can find and put it over the collagen, and then it causes maceration because it doesn't breathe like it's supposed to. So the beauty of these wound care kits is basically then you just hand these kits to the patient and it has everything you need in them. And so as you can see in this picture, it shows you kind of what is in these wound care kits. So the most popular kit, and the one that I always tell my physicians what to use, is for the most part these collagen powder kits. We use them in our own clinic for about 80% of our patients. We also, when I'm working with other doctors, I always tell them, this is really your collagen powder is by far kind of your gold standard of care and taking care of the majority of your wounds. So in these wound care kits, in a 30-day wound care kit, you're going to get 2 bottles of saline wash for them to be able to clean their wound. You're going to get 3 boxes of this Helix Collagen 3, and in each box is 10 packages, and so this allows them to have 30 sterile packages of collagen. And then you're also going to get 30 units of bordered gauze, and these come in either 2x2s or 4x4 as you kind of pick when you decide on your wound care kits. And then it also comes with gauze for them to be able to clean the wound or kind of help with a little bit of drainage. And so everything that the patient needs is in these wound care kits. So you're not having to kind of build these kits in your office, or you're not having them to also, give them the collagen and then still have them go to the pharmacy to get their secondary dressings. So it makes it by far the most convenient for your patient and also for your staff. So when should you be dispensing wound care kits? And it's going to be, they're considered post-surgical dressings. And post-surgical dressings mean that you have to have done some type of surgery on this patient. Well, a debridement, a 11042, is considered a surgery. And this is really what you should be billing, a 11042, whenever you're doing a debridement past the dermis of the skin. So the majority of patients that come in that you're doing a wound care debridement on, you are going to be billing a 11042. And basically what that's saying is that you're removing the dead tissue of that wound and doing it full thickness, meaning that you're doing it through the dermis and through sub-Q. And for most of us, when we are doing a sharp selective debridement, that is what we are doing. So you're going to go ahead and bill for 11042 when you do that procedure, and then you're going to be allowed to dispense post-surgical dressings or wound care kits to your patients. Okay, and it doesn't matter how long, like let's say you do a debridement and for some unknown reason you don't do another debridement for another month or two, you are still allowed to dispense surgical dressings, but you must have had a surgical occurrence happen. So with that wound, you must have had at least debrided it once. Okay. You can also bill a 97597 for a partial thickness wound, a partial thickness debridement. For many of you, some of you guys have been told to bill a 97597 as opposed to a 11042. You need to be very careful at looking at what that code actually entails, what that CPT code entails, because really that is a debridement to the dermis. And for most of you, if you're doing a sharp selective debridement, you're doing a 11042. So be very careful in billing your 97597s because really what you're telling Medicare is that this is not a full thickness wound and you're not doing a full thickness debridement. And for the majority of podiatrists, whenever they debride a wound, they're doing a full thickness debridement. Now, let's say that you do have a wound that is not full thickness. You can still dispense collagen. It probably won't take as long to heal that wound with the collagen, so you need to decide whether a 15-day kit might be more appropriate than a 30-day kit. Also, in our clinic and with other clinics, I recommend doing just depending on how deep the wound is, and if it's just really a partial thickness wound. The Amerigel post-op kits are also phenomenal for that. They will have your, the Amerigel hydrogel in it, and then it has gauze and it has Band-Aids or Coban based off of what you want. And these Band-Aids are the breathable Band-Aids, so you don't have to worry about the patient going and getting cheap plastic Band-Aids that are going to cause maceration of your wounds. So those are kind of two different options for you for dispensing wound care supplies for a partial thickness wound. Okay. So for many of you, what has kind of stopped you in the past of dispensing wound care supplies is that you're worried about insurance coverage. So for Medicare, insurance coverage is pretty cut and dry. Medicare requires that you have done some type of debridement or surgery previous to dispensing these wound care supplies. And the patients cannot be on home health or hospice because then the wound care supplies are supposed to be dispensed by home health or hospice. And so then you can't be dispensing them in your office. But for private insurances and for Medicare replacement plans and for Advantage plans, it can be very difficult for you to know whether or not these wound care supplies can be covered. And a lot of times, because you are giving them wound care supplies on the same date of debridement, the insurance companies like to kind of bundle that and say, well, if you did a 11042, you did a debridement, that's supposed to include surgical dressings. So then they think that when you dispense those surgical dressings to the patient to use them at home, that should have been included in your debridement. And of course, that is not okay. And you're not using them with that debridement. The patient is going home and using it. And so I always recommend that if you do have an Advantage plan, or if you are using it for private and health insurance, or it's a replacement plan, that you are dispensing wound care supplies the next day, just so that you don't have to deal with the insurance company thinking that you're unbundling your charges, because you are not. But Amerix also has developed this really unique program that allows you to ship treatment supplies to your patient's home. So if you don't want to do the insurance verification with your private insurance companies or your Medicare Advantage plans, and you don't have the staff to do that, or you're a little concerned about that, Amerix, you will just send in, Amerix just has this amazing program, and I'll go into it a little bit, of how you can just send these products to the patient, but also keep the revenue So you are able to just fill out this quick little order form, and then you're going to send this or fax it in, or email it, or put it in a Dropbox to Amerix. And then Amerix is going to actually then call and figure out your patient insurance information for you. So your staff does not have to waste time figuring out whether or not a particular insurance covers wound care supplies. Okay. And then they'll be able to, make sure that the patient actually has that insurance, and, if they have any deductibles or copay. And then Amerix will then call the office, and they're going to talk to, whoever you kind of put in charge, and say, hey, Mrs. Smith has a Medicare Advantage plan by Humana, and they cover wound care supplies, but they cover them at 80%. The patient will owe a 20% coinsurance. And so then that allows you then to call the patient and say, hey, you owe a 20% coinsurance on these wound care supplies, and collect that money up front, or you can choose to just bill the patient. But this allows you to, make sure that you still want this sent to the patient, and the patient is still okay with receiving it, even though it's going to be of charge to them. This can be highly effective for patients that have, let's say they have a $3,000 deductible. The patient still needs the wound care supplies, but allows you then to communicate that to the patient, and tell them the cost of those wound care supplies, so that they're able to, prepay for the wound care supplies, or you're able to bill the patient, and it is not a surprise. The practice will either approve or deny the order, and then you can go ahead, and then Amerix will go ahead and overnight these products to the patient. Okay, and so basically all products then can be shipped directly to the patient. And most of the time this is done overnight, so that the patients have them the next day, or within 48 hours of when you sent in that prescription. And so the patients are receiving their products quickly. Okay, then Amerix will then send you a delivery receipt showing that the products were actually delivered to the patient, and they will also give you the insurance information, so that you know how to bill and submit the claim to the insurance company. And then, since you are billing the insurance company for a product that Amerix drop shipped in your behalf, you are actually then receiving the income from writing these prescriptions and dispensing these products to the patients. It would just be as if you were dispensing them in office. You're having Amerix drop ship the product, and then you're billing the insurance and are receiving the revenue. So it's very different from you writing a prescription to a wound care supplier, and they keep the revenue. Amerix allows you to write the prescription to them. They are going to ship it and do the insurance verification, and then you are going to bill the insurance and make that income. Okay, and you also know that then the patients are going to be receiving a high quality wound care supply, so that they're able to heal quicker. So then the biggest question after I've run through all of this, and doctors are like, oh, well, this is a wonderful program, but then they're worried about how they're going to implement this. So it's wonderful for you to, decide, hey, I'm going to do this, and I'm going to increase patient compliance, and I'm going to allow my patients to heal better, and I'm going to make additional revenue. And doctors get all gung-ho to get started, and then they fail to implement it. And if you aren't implementing it, it's never going to happen. So it is vital that we learn how we are going to implement this into your practice. So there's a lot of different resources that Amerix has to help you implement and to help you get started. Okay, first of all is marketing. Many of you, after doing all of this, have decided, you know what, I really like the idea of having more wound care patients in my practice. I'm going to find that this is going to be really rewarding, that I'm going to save their limbs and save their lives, and that I'm also going to be able to make a decent amount of revenue by doing this. So Amerix has a few different marketing things out there. This is one fax that you can call your Amerix representative and get, and then you can go ahead and just kind of change it with your name and your company and your phone number. And we actually will fax these directly to providers, our primary care providers, our dermatologists, other specialists. And because a lot of times right now we're not allowed to kind of go out and go do what I call shoe leather marketing. And so this is a great way for you to communicate to your practitioners that, hey, you're doing wound care. So it's a great marketing thing. We also have some different other marketing resources that that you can get through Amerix so that you can bring more wound care patients into your office. Okay. So the other huge thing, in which most people know me by, is that I love protocols. Okay, I might have a small obsession with them. The reason why I love protocols is this is what enables you to actually implement a new program into your office. You can't just bring in products, whether it's wound care products or it's, you know, new cam walkers, or it's a new, you know, shock wave therapy machine or whatever. If you don't have protocols in place, those items will never get implemented into your office the way that they should be. So protocols are essential to your practice because it allows allows your staff to know what's going on. So when I build protocols for doctors, I build protocols from the time that a patient calls on the phone to the time that the patient receives the bill. So it's not just a protocol on what the doctor is doing. A lot of times in medical school, doctors are taught to do, you know, what's a heel pain protocol? Oh, well, my heel pain protocol is to examine, to decide that, you know, that it's plantar fasciitis, to take x-rays, and then to go ahead and do an injection. And they believe that that's their medical protocol. And that's great, but the problem is that you have a whole bunch of support staff that also needs to know what your protocol is and what role they play in that protocol. So I have developed some protocols for Amerix that if you call your sales rep, they'll be able to share with you. And basically what that protocol is it's stating everything that needs to be brought into the room. So when you do wound care, everything that you want the MA to bring into the room, you know, you want them to bring in your tissue nippers and your curettes. You want them to bring in your measuring tape so that you can adequately measure the wound. For many of your wounds, if it's a plantar wound, you want x-rays to make sure that there's not a biomechanical reason that is causing these wounds. If it's a deep wound, you want x-rays because you want to make sure that osteomyelitis hasn't set in. And so if a medical assistant is doing this before you enter the room, you're able to see more patients. So these protocols allow you to be able to teach your staff what you need in the room and what you need them to be doing in your behalf. Also, I have found it incredibly helpful if the MAs are bringing in these wound care kits into the room. Because as doctors, you get so busy and so overwhelmed that sometimes you forget what you usually do for your patients. And so by having the wound care supplies brought into the room, you're able to then go, oh yes, I need to prescribe wound care supplies. And it allows you to remember to do these things. Also, the protocols help your biller know what is being billed, because if you know, are always debriding wounds and then you're dispensing wound care supplies and you're doing x-rays, the CPT codes are already listed on the protocols. And so this helps your biller, it helps your front office staff when they're collecting money to kind of know what happened in the room or give them a good estimation. And then it tells your staff when your wound care patients are coming back. There is nothing worse than going to the doctor's office and getting up to the checkout counter and not knowing when you're supposed to be rescheduling your appointment. And then either the receptionist will be like, oh, hold on, let me go find the doctor, and you have to get pulled out of the room to, you know, reiterate when you wanted this patient to come back, or your receptionist goes, oh, well, I guess you didn't need to be seen again. I mean, it's asinine to your practice to have those things happen. And so the protocols allow you to be able to, you know, not have miscommunication within your staff, and to be able to have the things that you need in your office when you're doing a debridement, to be able to have your front office staff collect money when patients leave, and also to reschedule correctly. The protocols also help streamline training and kind of give individual responsibilities to different people in your office. And so the wound care protocols have been developed to help with that. And so those are available so that you're able to implement this new procedure of dispensing wound care supplies into your office effectively. Also, Amerix has some amazing support staff. There's several consultants on retainer to assist with practice support. I personally do a lot of training for doctors. I will help educate and, you know, motivate, you know, MAs to be able to dispense these products, or to answer any questions that associates may have or that owners may have at dispensing. I also work with billing staff a lot to make sure that, you know, that when you are billing these wound care supplies, that you're getting paid for. So if for some reason there is a problem and something isn't getting paid for, you can send your EOB to Amerix. You can black out names or whatever, and then Amerix will look at it. If they don't know the answer, then they'll contact me, and I'll be able to tell them, you know, oh, well, this got billed incorrectly. There's the wrong modifier there. There's a wrong diagnostic code, or whatever it is, so that we're able to get you get the claims paid for. We also have some amazing coding staff that's on there, and just practice management pearls that are available for you. We really want you to be able to dispense these products and to get paid for them. Okay, you know, there's additional support that Amerix provides. You know, we do the protocols, we do a lot of webinars like what we're doing today. There's a lot of blogs available. I've written a book called Got Protocols, and that kind of goes through how to build protocols in your office. And I know Amerix has a few of those to kind of give away, depending on, you know, how many you know, cases of product that you're able to purchase. They will kind of give it away as a free gift to you, and that allows you to kind of learn how to build other protocols in your office, not just wound care protocols, but protocols for heel pain, and protocols for, you know, ingrown toenails, and protocols for setting up for surgeries. So all valuable resources to your practice. And so now we're going to then this webinar is, you know, pretty much done. For any of you that have questions or concerns, we're going to go to a live question and answer. And then also, though, you are free to email me any questions or concerns that you may have at holly@burkmanconsulting.com, or you can reach out through my website at burkmanconsulting.com. And thank you.
Thank you very much, Holly. We appreciate your time. If anyone would like to connect with an Amerix representative today to discuss dispensing DME wound care direct to patients using our Patient Direct program, or in-office dispensing through our Doctor Direct program, please give us a call at 800-448-9599 or send us an email at sales@amerixhc.com and let us know the most convenient days and times to connect with you, and one of our account managers will call you back. In the meantime, we will go ahead and open up this presentation for the next 15 minutes for questions and answers with Holly.